It's day 268 since COVID-19 in Jamaica. For the nation's children, it's more than just the consideration of a potentially deadly disease. They must contend with the issues of online learning, sexual abuse, and welfare deficiencies. But how are the authorities seeking to make these issues better? Hello, I'm Damian Mitchell, and thank you for joining us for this special Gleaner Editors Forum. Today, children's issues in COVID-19. With us, Rosalie Gage-Gray, the Chief Executive Director of the Child Protection and Family Services Agency, the CPFSA. Also, Investigations Manager at the CPFSA, Stacey Ann Hewitt-Lindsay. Our Youth Policy Advocate, Matthew McHale, and Deputy Superintendent of Police at the Center for the Investigation of Sexual Offenses and Child Abuse, Ratliff Gordon. So let me begin by allowing you just about 2 minutes, exactly 120 seconds, to give a general assessment of the main issues facing our children just now and the state's response. Mrs. Gage-Gray, let me begin with you.
The COVID pandemic has had some impact, I would say significant impact on our children, those in state care and also on a general basis in the country. One, school is out, although school is in, meaning that children are not able to go out to physical school, and so not being able to interact with their friends over all these months, not being able to have a one-on-one with their teachers, and some children do learn better that way. So that's having an impact. The ability, they're not having the ability as well to go about freely, play with your friends in the community, having friends come over for those who allow that has been challenging. For our children in direct state care, we have had an impact. Socializing and social distancing is very difficult in that context, especially for those who reside in our residential facility. But we have been responding very well to the needs that we have. All children's homes, places of safety were provided with additional funds to make preparations for the pandemic. These include PPEs, personal protective equipment, and other psychosocial support. During this time, we have seen a lot of children having psychosocial impact, meaning that we have seen levels of depression, some suicidal ideation. And so the support that we give through our social workers or clinical psychologists has become very critical during this period.
Well, there are several issues we want to pick up on, but let me allow your investigations manager, Stacey Ann Hewitt-Lindsay, to come in here with her 2 minutes on what her assessment has been.
So the officers on the investigation unit, they work in the field, and the epidemic has had a significant impact on the way that they function because there are obvious risk considerations. That's not unique to us, I am aware. But we do not have the option of working from home. It's something that we tried initially when COVID-19 was new to all of us, and it lasted for a whole week or so. They are in the field as usual, carrying out their functions. For the families, what we are seeing is an increase in families not being able to provide in terms of basic needs because there's a lot of loss of income and stuff like that. Also, just more negligence, what we call negligence because of the families, parents are working, children are doing homeschooling and so on. So generally, those are the two main areas that I would say have been significantly impacted in terms of COVID-19.
Very, very interesting. We will pick up on some of these issues, of course, in the discussions that we will have in a short while. But let's also ask the youth policy advocate, Matthew McHale, for his general assessment of children and COVID-19.
So in terms of the situation, we're definitely seeing an increase in students not being able to have, as you know, access to education services that may allow them to thrive in schools. In terms of students being able to feel safe or have a safe environment that they usually have in schools. So to have that interpersonal relationship with teachers as well as fellow peers, that they may be able to be fully socialized. You know, that a lot of students strive on that, especially on the basis of being able to feel as though the information that they're receiving, it will be very difficult for them to fully grasp from the home situation. So in terms of students being at home, especially in the whole COVID situation, it definitely has been some trouble for them.
Very well. Well, it's a good time to bring in DSP of the Center for the Investigation of Sexual Offenses and Child Abuse, Isoka Ratliff Gordon, because he may be able to pick up on what the investigations manager at the CPFSA was pointing to earlier, that of neglect in the homes, and what other people have been saying, the matters of sexual offenses and the potential for a spike when children are home. What are you finding, DSP?
First of all, I'd like to thank you for giving us an opportunity to share in this forum. And just to say that our finding, or what we've been finding based on, first of all, I must say that we're a reactive investigative unit. And if the reports don't come to us, then there's little we can do in terms of getting a true sense of what is happening in the community. Anecdotally, we all usually say that there's just a percentage of the reports that come of the offenses that are committed. All of, especially sexual offenses, they're all not fully reported. And contrary to what is existing out there in terms of how COVID-19 has affected our children.
Mr. Thompson, let's have your 2 minutes just to give us an idea as to what you've been finding and what your general assessment is.
I just want to reiterate what was said by Mrs. Gage-Gray and Mrs. Lindsay. Certainly since this pandemic has started, we have seen a reduction in the reports that we have been receiving. And we have been very concerned at the agency that it's not that child abuse isn't taking place, but that the people who normally see these children are not seeing them and therefore are not reporting. So we have been doing a number of things as an agency to reach out to families, to children, to self-report. We have engaged in a number of initiatives to have children self-report through convenient means such as our WhatsApp line, that's our 878-2882 line. So we have been doing a lot of public education, having observed a significant reduction in the number of reports that have been received. So the agency is, doing a lot. You would have heard about some initiatives where we have gone into communities to sensitize communities to the issues and to make it convenient for them to reach out to us as an agency. We have also observed a reduction in the missing children reports, and we are also concerned about the children who are choosing to stay at home, certainly because of anxieties about the pandemic and because of the restrictions with curfew and so on. We don't believe that children run away from good things or good environments. So when they choose to stay, we want to ensure that they are in a safe and nurturing environment. And of course, we have, been continuing our efforts at getting children back home when they do choose to leave home.
Very well. So let me bring this question then to Mrs. Gage-Gray. You spoke earlier about the issues of psychosocial impact on the children. Are there any assessments that you can point to since this pandemic has started, which would support the assessment you have made in respect of the psychosocial impact?
Right, so working mostly with one of the things that we to do during this pandemic is to increase our support to our children, where we have our the Smiles Mobile, which is a mobile mental health unit, where officers there have been going to the respective children's homes to conduct a screening and assessment to see what impact, if any, it's having on the children. The reports coming out of those interventions highlights a lot of anxiety. We are allowing parental visits, but these, as you would appreciate, has been a little different in terms of having to maintain the social distancing, and that's difficult for some of the children. A lot of the children's home also gets a lot of support from donors and volunteers, which we have had to curtail to a great extent in most instances. And so, especially for this period coming up now, Christmas period, where we would have had a lot of involvement of volunteers going into the homes, that has to be restricted, and therefore the children are having a really difficult time treating with the matters.
Another element that we often do not hear about are the parents of children who would be incarcerated. They are not able to see their children this December as they normally would on Family Day, and also the children who would be in penal facilities, or at the very least in detention. What are you finding in those respects?
So the children in penal institutions would be the responsibility of the Department of Correctional Services. We are allowing visits for our children. Those who are being prepared for reintegration, for example, will be facilitated to go home these holidays if all the circumstances based on our investigations are okay for them to go. So what we will be doing is to ensure that we have increased, for example, contacts through telephone. The facilities where you can video call is helping us for the children to remain connected with their families. And so court is still happening, and those who have to be presented to court, we are facilitating those preparations for them to go. And so I think what has helped us, the children are really resilient. And so, it's surprising how some of them are still coping and surviving. If we as adults having difficulties wearing the mask, social distancing, and keeping ourselves sanitized, much less the children who, especially our younger ones. Our children, normally when we visit a facility, for example, they would run and hug you first go. You'll have about 10 children surrounding you. It's difficult to say no to those, because they strive on the hug and the compassion that you have for them. And so it's a difficult situation, but we are hoping, how we have managed in the facilities, for example, is to ensure that our staff, based on the Ministry of Health protocols, are sanitizing so that they can give those hugs.
We want to pick up on an issue you mentioned in respect of the close contact, but let me allow Cecilia Livingston to come in here with a question for the panel. Cecilia?
Okay.
Good morning.
And
Okay, I wanted to find out, early in the year, Clarendon came on the radar as an incest hotspot for children. Are there any improvements now, and do you have the latest stats?
I think that those reports came out of the Maypen Hospital, primarily the pediatric ward there. They were seeing an increase in the numbers that were being seen on the ward, and these are children under the age of 10, I think. I think the numbers, there were about 6 or 8 cases, which was more than they were seeing before. They were usually seeing 1 or 2 cases. So this was an increase for them, and that raised some alarm. Our surveillance of the parish to our investigators and our case officers in the Maypen office noted these, but overall we were not seeing a significant increase across the full age cohort, 0 to 18. But there was a specific reference to that. You would have noted, as reports in the media would have stated as well, I think we lost about 4 or so children, 2 to suicide, allegedly by suicide, 1 through an incident in Clarendon where 1 child was murdered. That's still under investigation. And all of these are children under 8. So we have had a heightened response for those age groups, children under 10. And for our system, once we get a report for a child under 12, we treat it as high priority, whether it's a missing child or a child who has been sexually abused or a child who is exhibiting some behavioral challenges. Once we get that, for example, for a missing child, if a child goes missing and the child is under 6 or so, it's heightened because usually those children don't run away. And so it gives us an alert that something definitely is wrong, and therefore the actions that we engage in terms of doing the search, helping families to locate those children is very heightened. So it is a concern. We have observed it, and we have been doing the surveillances right across all hospitals. The social workers there work very closely with us, and they follow the protocols in terms of making the reports to the National Children's Registry so that we can address those. As Ms. Lindsay said, our officers have not had a chance to stay home. They are in the field and working full time.
Which brings me right back to her, because I wanted to find out from her, how has she and her team therefore been managing to take stock of all these concerns of the children amid COVID-19, especially as you've said, there is now a heightened need for these kinds of services. Ms. Lindsay?
Okay, so in terms of, I'm starting again with personal safety. The agency does very well in providing all the gear that we need to protect ourselves. We have all our masks and sanitizers and overalls and you name it. Personal safety, the issues related to it differs from parish to parish, because in some parishes people are maybe taking more precaution than in others. Officers have to give them the mask in order to even interact. So in terms of the issues that I mentioned earlier, in terms of increasing neglect, and I want to say increase not in numbers, but more in terms of percentage. So if we get a case and to do with behavioral problem, we'll find that neglect is an element in that case as well. So increase in that sense. All right.
Are you finding though, Ms. Lindsay, where parents are becoming more frustrated having to be at home, some of them without jobs, and as a consequence, there is an increase in child abuse, physical abuse, that is?
I'm not seeing an increase in physical abuse, but physical abuse has always been an issue. It stays the same, but not an increase. I'm seeing more frustration from parents in terms of not being able to provide basic needs for their children. I'm seeing parents resorting to any measure that they can within the law, in most cases, well, in all the cases that I've seen, to provide for their families. Trying to seek help from outside sources and so on. In terms of, so they are frustrated in that sense. In terms of measures that we have implemented, we are working closer with the schools for children who are at home, maybe not having access to certain devices. We are getting physical work from the school and giving it to the children, ensuring that the parents are communicating with the schools and they are doing very well in terms of providing the information that the children need for homeschooling and so on. So this is a difficult time for everyone, and we have to think outside the box. I wouldn't have the time to tell you all the examples of things that we are doing differently, but put it this way, we are doing everything that we can to protect our children and to ensure that they are not at a disadvantage at this time.
What we are seeing actually from our numbers here at Sisoka, which I must put into context, in that Sisoka, my office collates figures for the Kingston and St. Andrew area, while we do have our relationships with the other areas. They maintain their own other divisions, such as in the rural areas and St. Catherine. They maintain their own statistics, but what we can extrapolate from what we're seeing is that there has been a decline in cases, especially those cases that relates to children. For example, for the offense of sex under 16, we are seeing a 17% drop between for this corresponding period, January to October. In that last year, we had 339 reports as against 280. Another offense that strictly touches on children, sexual touching, we have seen a 29% drop from 31 to 22 reports between January and October. No, we're not saying that it's not occurring since the start of the pandemic. But what we're saying that what we're seeing in the reports that has been made to us is that there have been a decline in the Kingston and St. Andrew area. What we can say though, in terms of our operation here at SO, is that we have never stopped working.
Yes. Well, let me touch on an area that you haven't mentioned yet, and that is the matter of coaches and abuse, physical and sexual abuse. Naturally, in this period, you would not have had many incidents reported of coaches and abuse. But are you seeing where there has been any clearing up of those cases mentioned?
We have. Mr. Wright, what I can tell you is that all those cases which involve, persons in institution, those are what we call our priority cases, and we treat them urgently. And I don't have the figures here with me, but I can tell you from my desk, where I sit, is that those cases are treated with priority. Another interesting piece of information I could share with the group is that where offenses involving children are concerned, especially sex under 16, we usually see a high incidence of young offenders, meaning that they're also minors. But what we're seeing in the reports of sex under 16 is that it's predominantly adult offenders, and that might be a feature of this pandemic in that the young ones are not getting a lot of opportunity to interact with each other. So where the offenses that relate specifically to children are reported, the offenders have been increasingly adult offenders. So that's a way in which we think the pandemic has affected our children, in that they are more being impacted by adult offenders, where in non-COVID times, would see a very high percentage of the offenders being themselves children.
We're fast running out of time for this segment, and Jordana Murphy has a question. But before her, I want to ask Mrs. Gage Gray, this program of Take a Child Home for Christmas, is that likely this time around?
So we have to, as they're using the buzzword now, pivot on that. It's gonna be difficult for us to have the children go to families in the usual way that we have promoted over the years. The risk for that, what we have to do, once a child is taken into a facility new, we have to isolate them for the 14 days as according to the protocol. And so the difficulty this year is how to facilitate that. So what we are doing differently is to grant a wish. We want persons in the communities in the country to grant a wish to a child. So our PR team is working with the different homes and the foster carers to have those children write their wishes. And then we will solicit help to grant those wishes over the holiday period. All our staff are on board for this initiative, and we're asking as many persons as possible to help grant the wish for a child in care this year. So that's what we're doing.
Matthew, what do you find are the greatest needs of your peers?
As a whole, as it relates to the pandemic as well, one of the greatest needs is for them to have equal opportunity, for there to be some level of equitability, whether it relates to education or being able to feel safe as children. Definitely, that is one of the greatest needs all children face across the board.
Let me ask Jordana Murphy to come in here with her question. Jordana?
Mrs. Gage Gray, what is the anecdotal or empirical evidence saying about the impact of COVID-19 on children's mental health and social interaction skills?
Right, very, very significant impact. As I said before, we are seeing a lot of psychosocial issues that are presented in children generally. There's a lot of fear of the unknown, fear of their relatives or families coming down with the COVID, fear of themselves getting it, fear of especially for children with pre-existing conditions, this is causing that to get worse. And so we have had, as I said before, have to implement and put in the resources now to ensure that all our children are getting the support that they need. We have been seeing a number of suicidal ideations, cuttings, and thankfully we have not had any significant or serious impact. For us, any indication of suicidal ideation is treated as a high emergency, and these children are usually taken to the hospitals to be treated. And so we are taking this very seriously. The children are coming under extreme pressure and stress. Usually play is the thing of children. They play, they interact. Not being able to do this, you know, on a daily basis is going to have an impact. For those in the children's home, we are seeing that they do get the opportunity for recreation and play much more. But once we had seen the numbers climbing, we, so over the August to September period there, we have had to implement the wearing of masks for most of these children.
Great timing, because we now have the State Minister for Education with us, Robert
Yes.
Nestor Morgan. Thank you so much for joining us, Minister.
Thank you so much for having me. I apologize for being late. It's been a interesting day.
Yes, we do understand. And several issues have already been discussed, but let me bring back a couple of them for you, because certainly some of them fall right into your lap as State Minister for Education. One of them is the matter of online learning and whether there has been any improvement in respect of access to devices for this to happen.
Well, the challenge that we face with online learning is not just devices, it's also a challenge in terms of access to the internet and so on. So what the ministry has done is we have sought to engage a blended approach, as you would have been aware, where we're not just speaking about a virtual learning environment, we're also talking about learning kits that have been distributed and other facilities. And then a part of that is our pilot program as it relates to face-to-face, where we had 17 schools, and now we're seeking to expand it to more schools as we learn from what we have done at the pilot phase, and we are engaging with the Ministry of Health and the schools to do that. So the reality of it is that the best way to learn and teach is face-to-face. But we also acknowledge that there are inherent risks based on the current challenges with COVID-19 in assembling hundreds of thousands of children in schools. So what we are seeking to do is over time, see how we can create an environment where the school can become a safe space for the students as much as possible, especially students who have greater vulnerabilities in terms of access, such as students who are in communities where there is a low internet penetration, poorer students, students who are about to do PEP or GSAT. Those are the ones that we're trying to prioritize.
This issue also came up as it relates to what will be happening for the parents who are behind bars. Of course, visits are restricted, but at the same time, there has not been the use of technology to facilitate visits, certainly from children. Is this a part of your consideration as part of the team helping to fix some of the psychosocial issues arising from COVID-19 for children?
You're asking me to speak on a matter that is outside of my remit. That the protocols that govern prisoners and their access to the outside environment is solely within the remit of the Ministry of National Security. It would be inappropriate for the Ministry of Education to publicly make a comment on the protocols of the ministry, other than to inquire as to what the protocols are that they have, but I could never.
Well, let's look at the issue of children's court. You might have caught the discussion on that. Is this something that your government would be pursuing?
Well, I would have to consult with the Minister of Justice on that. I know that the discussion has been taking place for a while, but I was not briefed on that matter before I came on. So I would definitely, you see, the matter of courts and which courts you establish is also within the remit of the Ministry of Justice. I think the Minister of Justice is aware of conversations. So I would definitely have to speak to him about it to get back to you.
We have just about a minute left, so let me end by asking you to complete this sentence. And since you're on the floor, Mrs. Gage Gray, for 2021, we must?
For 2021, we must redouble our efforts to secure the rights of our children and to keep them safe. We must provide the resources that are required for families to be able to take care of their children, because the family is the best environment for any child to grow.
Mr. Thompson, for 2021, we must?
We must do all that we can to make Jamaica a place fit for children.
Mrs. Hewitt-Lindsay?
We must, as families, support each other, because the state agencies alone cannot handle the job that is required to take care of our children. So families need to support each other in care of their children.
DSP Ratcliffe Gordon, for 2021, we must?
I guess we also might have to pivot to that kind of way of disseminating the information of the avenues of reporting.
Right. Mr. McHale, so for 2021, we must?
We must continue to listen and especially attempt to bridge the gaps and the further disparity that the pandemic would have even created.
And that brings us to the end of this special Gleaner Editors Forum looking at children's issues. We want to say thanks to Rosalie Gage Gray, the Chief Executive Director of the Child Protection and Family Services Agency, the CPFSA, Investigations Manager at the CPFSA, Stacey and Hewitt-Lindsay. We'd like to say thanks also to Mr. Warren Thompson, to Robert Morgan, State Minister of Education, Youth and Information, Youth Policy Advocate Matthew McHale, as well as Deputy Superintendent of Police at the Center for the Investigation of Sexual Offenses and Child Abuse, Sisoka Ratcliffe Gordon. I'm Damian Mitchell. Thanks for joining.